pain in the outside of the hip can often be a clinical conundrum. This area of pain, we originally thought it to be greater trochanteric bursitis, and that kind of led clinicians down the rabbit hole of providing corticosteroid injections within this bursa to kind of calm that down. Lateral hip pain is particularly common in females, in the like 30 to 65-year-old, and we see it a lot in clinic. Clinically, I think a lot of times referrals get placed for SI joint pain. Maybe people think they have sciatica because they're starting to get that buttock pain. But most often what we find, especially within that population that I mentioned of the females 35 to 65, is that it's actually the gluteal tendon or the glutes that is inflamed. So if we can remember our anatomy a little bit, a muscle becomes a tendon as it attaches to bone, and if that tendon gets irritated, it can create pain within this. Now, there's also a ton of other conditions that can cause pain in this way that we will discuss in later videos, but for this one, we're going to dive into a research trial called the LEAP trial that looked at 3 different approaches to treating lateral hip pain. So the 3 approaches we're going to discuss that were mentioned in this trial are exercise and education, corticosteroid injection, and wait and see approach. So the wait and see approach just involved 1 session, kind of a little bit of education, a little bit of guidance. Goodbye, see you later, we'll see you at follow-up. Corticosteroid injection is ultrasound guided injection of medicine to decrease the inflammation within that area of the lateral hip, whether that's greater trochanteric bursitis or the gluteal tendinopathy. 2 conditions that we give separate names but basically mean the same thing. And then the other group is the exercise and education. So that consisted of 14 sessions over 8 weeks. And then the study looked at follow-up at 8 weeks and 52 weeks, and the things that they were trying to measure the most are global rating of change, which would be like a sliding scale of very much better and very much worse and everything in between, as well as pain intensity in the last week. And what they have found, which is consistent with a lot of research, is that corticosteroids generally do pretty well in the short term. They decrease pain, but it doesn't necessarily result in lasting improvements. So this research study would confirm that, except even at 8 weeks, the exercise and education was doing very, very well compared to the corticosteroid. So that's interesting for our practice in chiropractic and sports chiropractic, because I think that a lot of these patients can get better with what we provide in exercise education and then spinal manipulation, the muscle work, etc. My only question was can we realistically, those 14 sessions, can we whittle that down and educate our patients enough to maybe get that accomplished in 6 to 8 visits or 8 to 10 visits? I think that is where we really see lasting improvement, and it's not a surprise that corticosteroid injections do really well in the short term and they don't do so well in the long term. That's not good for those tendons to be bathed in steroid. It helps with the pain, but it doesn't fix the movement pattern. So it's no wonder a lot of these people at 52 weeks continue to have pain within the last week, because by then all that corticosteroid has kind of processed, the aggravating factors have never been appropriately addressed, and the patient doesn't really have any tools in their toolbox to kind of treat this themselves. And that's what we try to do here in the clinic, is exercise education. Okay, how can I build up the robustness of that gluteal tendon to get it to respond and be able to do the things that I want it to do, whether that's in the gym, playing with my grandkids, working as a nurse and transferring patients. So that age group, those females with lateral hip pain, 35 to 65, it's common. And it also makes me question, like, that lateral hip is a very difficult area to treat. There's a lot of things that can cause pain in that region, and I think sometimes this study doesn't capture that, because this study confirmed gluteal tendinopathy both from a physical therapist diagnosis and then an MRI. In clinical practice, when people come in through our door right here, they don't say, I have gluteal tendinopathy. They say, the outside of my hip hurts, and it's my job, and that's the fun challenge that I get to do, is say, is this gluteal tendinopathy? Is this actually a sneaky facet joint syndrome? Potentially it's an SI joint pain that actually is referring into that area. So I think that's the fun challenge, but I want to kind of address that exercise and education many times provides greater long-term relief than a corticosteroid injection. So I would question, even in those patients that do end up getting a corticosteroid injections, could they benefit from exercise and education, and most likely that is the case. So let me know if you have any questions. We're going to dive into some more research trials in the future so we can better understand what we do in here to get patients the best results. Dr. Peters, Omni Chiropractic, providing solutions to pain and performance.